Hi, I'm Amy DeLuca, and this is Care New England Talks Your Health. I'm here with Dr. Charles Eaton, the director of the Heart Disease Prevention Center at Memorial Hospital, and you're also a professor at Brown University.
Yes. Hi, Amy. And I've been studying heart disease for the last 24 years and run this center here at Memorial, taking high-risk individuals at risk for heart disease and trying to prevent that.
All right. Today we're talking specifically about women's heart health. At what age should a woman begin thinking about heart health?
Well, really, it's a lifelong process. So most heart disease is related to atherosclerosis, so the arteries of the heart that fill up with the cholesterol-laden plaques and then rupture and cause heart disease. And it can also affect the other blood vessels. But we know from studies that actually, even when people die at even a young age, even in teenage years, that they actually have the beginnings of these plaques. So it's really a lifelong process.
Is it something that's starting to show up younger?
Yes, because of the obesity epidemic, we're seeing many more children being obese. And so the studies that have actually looked at that over the last 20 years are showing that we're seeing this using non-invasive means, showing this plaque being built up even in as early as in the late teens.
Well, obviously genetics are beyond our control, but what are some ways that a woman can have some control over her own heart health?
Well, it's important to understand what your familial risk is. So although genetics can't be changed, you can tell whether you have a higher risk from your genetics. So a family history of heart disease, so that's in a woman less than age 60 and a parent or brother and sister, and in a male less than 55 years old. Also, the risk factors for heart disease, such as diabetes, hypertension, run in families, and as well as high cholesterol or hyperlipidemia. So knowing that would particularly put a woman at risk and really should focus even at a younger age because of their higher risk. But the things that you can do are really, American Heart Association has come up with what they call the Simple Seven. And the Simple Seven are really the things that are common sense and most people know, but they're related to having a healthy diet, regular physical activity, controlling your blood pressure, not smoking, preventing yourself from having diabetes, and maintaining a healthy weight. So the way you can do that is really, much of that is through lifestyle. And so one of the ways for blood pressure, you want it to be less than 120/80, so some of it is knowing your numbers. Cholesterol, having a cholesterol less than 200. For sugars, keeping your blood sugar below 100, or hemoglobin A1C less than 6. So many times people are now going to the doctors and finding out these numbers. But the biggest thing is through a diet, a healthy diet and regular exercise. So we want to get about 10,000 steps a day, which is about 30 minutes of moderate activity over a week, of 150 minutes over a week of moderate activity, or 30 minutes of vigorous exercise, such as going to the gym, jogging, being in aerobic classes, things like that. If you do 30 minutes 3 times a week, that fits the criteria of really a healthy, active lifestyle. In terms of diet, it's particularly important that lots of fruits and vegetables, about half the plate. Lean protein, in other words, that's usually fish, poultry, and nuts. And then getting rid of the empty calories, so sugars, sweetened beverages, meats, lots of red meat.
I have learned a lot. Thank you so much, Dr. Eaton, for being here for Care New England Talks Your Health.
Thank you.